Hi, my name is Dr. Kit Langstroth, and I'm going to share some shocking information with you about fibromyalgia. What is that shocking information? Fibromyalgia really isn't a muscle problem, it's a neurological problem. How do I know that? There are literally hundreds of research papers out there that prove it. And my 23 years of helping fibromyalgia patients has evolved into a realization that addressing fibromyalgia from a neurological point of view really does get the best results. So why isn't this common knowledge? I think there's several reasons. First, I think there's insufficient training in medical schools across the country. There's also a certain stigma associated with people who have chronic pain and multiple symptoms. Many doctors have literally been trained into thinking that it's hypochondriac roots and is really psychosomatic. Why? Because you have so many symptoms associated with it. Medication is the number one medical treatment, and yet they don't address the neurological cause of the problem and underlying contributing factors leading up to the full-blown fibromyalgia symptoms. We're different in how we approach things. We look at the big picture. Now, this is very important. The reason I say this is because what we have found out is that you can have 10 fibromyalgia patients with the same identical symptoms, but all of them have different contributing factors, and regarding treatment, one size or pill does not fit all. What I'm going to do now is explain the part of the brain that causes fibromyalgia symptoms. Now, the normal neurological pathway goes like this. Information from the left side of the body travels into the spinal cord, into the cerebellum on that same side, which then crosses over into the opposite hemisphere of the brain, and that information then goes into a part of the brainstem called the mesencephalon. And what it does is if the brain is firing properly, it will mute or quiet the mesencephalon down. Now, this mesencephalon, which is located in the midbrain, is like an unruly teenager, and it needs a lot of supervision. And when it doesn't get that, it's allowed to create havoc in the body. What we are finding out is that parts of the brain are not doing their job. They are under firing and not slowing this mesencephalon down, so it overfires. It can cause considerable problems with sleep because when overfiring, it increases awareness and attention. It's also associated with intestinal function, so you could get diarrhea, constipation, or irritable bowel syndrome. It also affects heart function and can cause irregular heartbeats or palpitations. It increases adrenal gland function, which overproduces cortisol into the bloodstream, which can be toxic to the brain, causing an inability to think straight or find words to communicate your thoughts. The mesencephalon also causes the adrenal glands to produce substances which literally increase the sensitivity of all the nerves in your body. You feel pain so much more than the average person does, including headaches, migraines, and overall body pains. These are sympathetic nervous system responses that also control the size of your pupils, letting too much light into your eyes, leading to light sensitivity. It's also close to areas of the brain that increase sensitivity to sound. An increased sympathetic response can also increase sweating or perspiring. Many of you simply overreact to stressful situations and are affected by them much greater than others because your sympathetic nervous system is already on alert. All of these symptoms are a result of the mesencephalon becoming overactive that can be fixed with finding and locating the side of the brain or cerebellum that is under firing, leading to the overfiring midbrain. We can help that. So how do we find your problem? We can perform a variety of neurological tests, all completely painless, to hone in on what the problem is. They can give us some extremely vital information as to which side of the brain is the problem area. Looking at specific eye movements to see if they are jerky or how fast you can move your eyes in certain directions, testing your smell, facial reflexes, balance and coordination tests associated with cerebellum dysfunction that will allow us to hone in on which side of the brain is the problem. Once we find your specific neurological deficits, our job is to go in and help that area function the right way. We're not going to do what everyone else has done in the past by giving you another drug that doesn't work. We're going to give your brain exactly what it needs to balance out the two hemispheres and melt away these symptoms you're having. The results are pretty amazing. And we've also realized that almost all fibromyalgia patients have a problem with oxygen metabolism. On a cellular level, your cells are not producing enough ATP, which is the energy that's produced from normal cellular metabolism. Most of you are operating in an anaerobic state, and when that happens, your muscles are going to produce way more lactic acid, and that's why you have so much muscle pain. Now, since your brain and nervous system absolutely need oxygen, we utilize oxygen therapy in our office to catapult you to the next level for nervous system repair. And then on each visit, we build up the oxygen levels and immediately activate the brain. How do we do this? Through sensory stimulation, only on one side of the body to activate the underfiring side of the brain. We utilize eye exercises, smell, sound, vibration, transcutaneous electrical nerve stimulation below sensory threshold, stimulating acupuncture points on the ear, heat therapy, spin therapy, visual stimulus through pictures and symbols that only stimulate one side of the brain. There's even manipulation in the arms, legs, and on one side of the spine for one-sided stimulation. Patients sleep better, pain starts to go away, they think more clearly, and have more energy. They can start to get their lives back and particularly go back to work again. I think that's the number one thing that is said. I've gotten my life back. They can begin to exercise again and lose weight, because when you hurt all the time, you don't want to do anything, especially exercise. Now, I had mentioned contributing causes of fibromyalgia that lead into the neurological underfiring of the brain. What this is, it's chemical, physical, or emotional stresses or abuses that you've sustained in the past or present. Emotional stress originates within the brain as thoughts of frustration, betrayal, anger, hate, and so on and so forth over a period of time that leads to a sympathetic overload and cause this cycle to develop. Physical injury or auto accidents can also do it from injury to the nerves. You need healthy nerves to send proper information to the brain for normal activation of the brain. We can help people like you as well. Last and very important is poor diet, toxicity, high blood sugar issues, anemias, bowel problems where undigested foods can re-enter the bloodstream causing an autoimmune response. There are thyroid issues, underlying infections, deficiencies, and inflammatory processes, and even hormone imbalances. This is where blood work can be very effective in locating contributing factors, and we can also treat that as well. And I want to make a very important point here. Half of the tests you need will never be given to you because they aren't considered medically necessary by your doctor or the insurance company. You know, we're in HMO and managed careville here in Sacramento, so it just doesn't happen. They often do general blood work and tell you there's nothing wrong with you. You and I both know that's not true. You feel miserable, and they just aren't doing the correct tests. You see, we want to treat the big picture, not one drug fits all. Your liver, which may be in overload to begin with, now has to work harder to metabolize more toxic medications when they keep giving you these medications. So that's the last thing you need. What you want to do is find a doctor who will find out what your concerns are and what's wrong with you and what your life's been like, and not leave any stones unturned. You need a doctor, or yes, you should say you don't need a doctor that thinks it's all in your head and dismisses you. We'll give you options and hope, and if you want to make some changes and you are truly ready, then call us. The reason we get such great results is because we look at the big picture and treat everything at once. So if you're tired of being sick and losing your life, then please call us. Thank you.